Great. Why don't we go ahead and get started? My name is Allison Neswood. I'm the Deputy Director of Strategic Priorities at the Colorado Center on Law and Policy. Thank you for joining us today for this presentation featuring David Flaherty from Magellan Strategies. Magellan Strategies is a respected Colorado-based opinion polling and research firm. And last spring, with generous support from the Colorado Trust, we were able to contract with Magellan Strategies to survey Coloradans about their experience with hospital bills, and to particularly focus on the experience of Coloradans who are low income or facing economic insecurity. During the 2021 legislative session, in partnership with many of you here today, CCLP worked to pass hospital financial assistance legislation in House Bill 211198, sponsored by Representative Iman Judah and Senators Janet Buckner and Chris Kolker. The legislation, which goes into effect next summer, aims to make hospital bills more affordable for low-income patients, to ensure more people are getting connected to health coverage or to financial assistance in the hospital, to streamline the process of applying for assistance, and to ensure that there's opportunities for enforcement of the new law, both at the administrative level and by individuals. But our work is not done. The law has passed, but it's now in the process of being implemented through regulations and through patient-facing forms and notifications. And the data you'll learn about today, we think really underlines the importance of strong implementation, and that it also provides an important baseline for measuring the effectiveness of reforms and to illuminate our path forward from here. So if you have questions that come up as you hear from David, please add those to the question and answer function. We will address questions added there at the end of the presentation, and we'll also plan to allow people to come off mute at the end to ask their questions at that time. So without further ado, thank you so much for joining us today, and I'll turn it over to David.
Thank you, Allison, and thank you everybody for making the time to sit in on this webinar and learn what our observations were from this unique survey research project. So with that, let me get right into this. This is a very unique survey, and as a researcher, we interview adult population, voter registration populations, but a project that is really geared towards measuring the opinions of Coloradans with lower incomes. Not only that, but also visited a hospital, specifically a hospital within the last 12 months, is a relatively narrow population to identify and measure. And what we did is we utilized MMS text data collection. Over on the right-hand side, this is an image of the text that people received that we sent out in both English and Spanish, using census tract data, income data around certain hospitals across the state of Colorado to reach out and invite these folks to participate in this survey. In the end, we interviewed 441 Coloradans, again, who have utilized or visited a hospital within the last 12-month period. The margin of error on most of these observations is plus or minus 4.67%. And we conducted this survey from late May into early June. What were our objectives? First and foremost, understand the hospital visit experience for Coloradans with lower incomes who did and did not have health insurance. That's what we really wanted to learn. What was their experience like going and visiting to meet their healthcare needs? Second, we wanted to understand if hospital staff were connecting patients to public coverage programs like Medicaid or to other hospital financial assistance that they may qualify for. Did staff reach out and say, hey, you qualify for this or that? We also want to measure simply the affordability of healthcare and the ability for patients to pay hospital bills, including out-of-pocket costs among this lower income population. And then some other simple things. We want to see and measure opinions about how easy was it to understand their hospital bills. And then finally, how many of them were aware of their local hospital's annual community health needs assessment. Moving on, here's some of the survey demographics, excuse me. Usually we move the demographics into the back, folks, but we wanted to point out this population is not male, female, 50-50%. We didn't weight this data because it was literally, the folks that qualified, lower income, and they felt that that healthcare was affordable, and I'll get to that in a minute, and visited a hospital, is a narrow range. So what was it? 67% of our respondents were female. Hispanic versus non-Hispanic, 85 to 15%, relatively close to what census data shows. Individual in the household, 18 or younger, families, 32%, which is very on par with the overall population. City versus urban, our sample was more among city and urban residents compared to an adult population where that suburban number is usually higher. But the rural and small town areas are relatively same. So again, this is just for you to digest and understand what was the demographic makeup of these individuals that we interviewed. And then also, what was the income? Not surprisingly, more than 50% of respondents had household incomes of $49,000 or less. And you can see on that bottom chart how it goes from high to low. And then the age, it kind of moved around some, folks. But again, that's what our data showed from this sample. Moving on, respondent screen questions. And what we're asking here is, another measurement was we asked people at the beginning, thinking now about the cost of healthcare. How affordable is the cost of healthcare to you and your family? 50% of these respondents said it was very unaffordable. 27% somewhat affordable. Now, we did allow folks that said it was somewhat affordable simply because we were trying to find folks that said that it was unaffordable, but also visited a hospital in the last 12 months. So we kept them in to keep our numbers up, so we had a larger sample size. Gender and age range is broken out there accordingly, as you can see. I'm not going to focus on that too much. Child in a household versus no child in a household. City versus suburbs, small town, rural, and rural America. Again, but of this sample, 77% said that it was unaffordable. So this is how we pre-qualified folks before we really brought them in and started asking specific questions about their hospital visit experience. Other things that we did ask, just to break down here, thinking now about the cost of healthcare, again, how affordable is the cost of healthcare for you and your family? Obviously, these numbers are approaching 8 out of 10 respondents that were coming from households that had income of $30,000 of less, and so forth. As you can see, these gray bars, that's the percentage I was saying, very unaffordable, up to the 150,000 household or more, 57% saying it was affordable. So. And then here's our data showing the same question broken out by race. And as you can see, even though we had folks in their populations of color or not, all of these respondents were on the lower income and challenged in saying that they found healthcare affordable. Okay, moving on. Our next question, have you utilized healthcare services at a hospital for any reason in the past 12 months? Please keep in mind that we are asking you if you visited a hospital rather than a healthcare clinic, an organization, or a business that provides healthcare services. We want to be very clear that we were referring to a hospital visit rather than these other types of places. And then moving on from there, I apologize, I'm having a little bit of a trouble with my pointer here. Okay, measuring the awareness of hospital financial assistance and health insurance at the time of the hospital visit. We asked folks, excuse me, let me go back one up. I'm sorry, we're having some trouble here. Whoa. So once somebody qualified, said, yes, I have visited a hospital in the last 12 months, we then measured and asked them whether or not they had health insurance and what kind. At the time of your hospital visit, are you covered by any of the following forms of public or private health insurance, or did you not have health insurance at the time? As you can see here, yes, plan through employer, yes, Medicare. We feel that a lot of this data does match up with the adult population that we are aware, but most importantly, 5% of respondents said that no, they did not have health insurance. Now, we know that from data that number is probably around 8 or 9% for adult Coloradans. But again, we were working really hard to get as many of those folks as we could. And moving on to the next question, did you know that Colorado hospitals are required by law to provide financial assistance and discounted healthcare services to patients in households with less income? Now, keep in mind, this is a population of folks that have just visited a hospital in the last 12 months. Did you recall, did you know whether or not this law was provided? We wanted to know maybe this was going to be a higher percentage. than perhaps the general population. But among these folks that have just interacted with the healthcare system on hospitals in the last 12 months, 65% said no, they were not aware of this law to provide assistance. 35% said yes. And then just to point out, here's the response to this question by the type of health insurance or not health insurance as you had, that the respondent had. As you can see, 71% are not aware of this, slightly higher than the average among folks that were uninsured. And then also folks that said had insurance through parents. Allison, you have any comments on this you want to add to, or?
Yeah, thanks, David. And just wanting to flag that, the existing sort of hospital financial assistance laws that have been in place are really targeted towards this population that have health insurance. And so we were looking at this number as really high and showing that, the protections and the provisions that thus far have been in place have really not been benefiting, or at least this data suggests that those provisions haven't been benefiting this population. But overall, it's just a high number. I think that's 65%.
Yes, and again, folks, this is sort of a benchmark measurement, something to hang our hat on moving forward. So that's what the survey measured. Okay, then we had questions for respondents who did not have health insurance at the time of the visit. So we are being very straightforward here. Only 24 respondents did not have health insurance. Keep in mind, though, it is very difficult as a researcher to find these folks and identify them, through the methods that we use, other than literally camping out at hospitals at a cost that's really sort of unreasonable. So the responses to these questions are plus or minus 20%. We want everybody to be aware of that. We are not saying this was a huge sample of uninsured. We're trying to be very straightforward with you of what we measured. And here's the questions that we asked these folks. Did the hospital offer to check your eligibility for Medicaid or public health insurance programs? Only 21% said yes. 8 out of 10 said no. Did the hospital offer to check your eligibility for their hospital financial assistance program? Again, 8 out of 10 said no. Did the hospital offer to provide you with a payment plan to pay for the cost of your hospital visit? 21% said yes, 79% said no. And then of that 21%, it's only 5 people, folks. So please, we understand that on that pie chart to the right, were you able to afford the plan? 40% said yes, 60% said no. But again, this population, these 24 respondents, obviously these numbers are not great. And we would have hoped to have seen them being better. But we fully acknowledge this is a smaller sample size. Further questions. Taking into account other monthly expenses, which of the following would be an affordable hospital bill monthly payment plan for you? Trying to understand from these respondents, what could they afford? What would they be comfortable with? 6 out of 10 said less than $50 per month, 33%, $50 to $99 per month. So clearly $99 or less is sort of the range, but definitely something $50 or less is something they felt that they could afford. And then we also asked the question, how many months of payments could you afford? And here's the range, 38%, 6 months or less. 4 out of 10 of these folks, not a very long time, obviously. And then we asked them, if you primarily speak a language other than English, were you offered hospital financial assistance information in your preferred language? Now, 88% of these respondents, these 24 individuals, said, I only speak English, so it's a small sample size. That other 80%, that did speak another language, all of them said that no, they weren't offered the financial assistance information in their own language. Moving on, questions for respondents who had health insurance at the time of their hospital visit. This is obviously a much larger sample of 417 individuals. And we began our questioning of these folks about out-of-pocket costs. Do you remember the amount of the out-of-pocket costs that were not covered by your health insurance that you had to pay to cover the cost of your hospital bill? So understand something, 84% of folks said, yes, I do remember. We needed to qualify and make sure that respondent remembered to ask or respond to the next set of questions, accurately and correctly, if you will. 16% said they did not remember. So out of the amount of the amount of out-of-pocket costs, nearly a quarter of them were $100 or less. And this is the breakdown of what the amount was for these individuals. So you can see from low to high. Again, we're just collecting that data to just get an idea, how big were these, and perhaps to some people, this may not seem like a lot of money, but at least one quarter was $100 or less, but 75% or more, $100 or more, when we know, a lot of this population is saying of what they can afford, this is challenging for this population. And again, these questions were asked of folks that remembered the amount of their out-of-pocket costs. Were you able to pay these out-of-pocket costs in full? 60% said yes, 40% no. Did the hospital offer you a payment plan for your out-of-pocket costs that were not covered by your health insurance? 62% said no, 38% yes. And then among that 38% that were offered a payment plan, were you able to afford it? 66% yes, 34% no. Not bad, but still measurable amounts and some gaps here on meeting these financial needs. Furthermore, taking into account the other monthly expenses, which of the following would be an affordable hospital bill monthly payment plan for you? Again, we asked this to the uninsured, now to the insured. But again, nearly half said less than $50 per month. And then 33% said $50 to $99 per month. And I just want to point out, when we ask a question like this, some people are like, oh, everybody's going to pick the lowest amount. Well, no, they're not. They are honestly answering these questions based on their personal situation. But again, we find that 99%, $99 or less really covers a lot of what these folks are looking to do, if not $50 or less. And then again, how many months of payments could you afford for these hospital bills? A quarter, 6 months or less, 31% or half, or really 12 months of payments or less. So again, pretty pressed. And again, we asked them, if you primarily speak a language other than English, were you offered a payment plan information in your preferred language? Again, 86% said I only speak English, but among the 14% that speak another language, 6% of them said yes, they were offered information in their language, and then 8% were saying no. So of that 14% of this 348. Okay, we had some questions about hospital bills and hospital debt. Have you had trouble, being late paying a hospital bill? And this was asked to all respondents. 36% said no, 2/3 said yes. Slightly higher among female respondents here. And again, here's the breaks by age range. But again, 2/3 of this population are having trouble paying, a late hospital bill. How difficult was it for you to pay off the hospital bill? And again, this was asked to respondents who have had trouble or been late paying a hospital bill. 282 respondents, just over half of our sample. 58% said it was very difficult, and 33% somewhat difficult. So very or somewhat difficult combined. 9 out of 10 of these folks, or half of our sample, said they had their difficulty paying it off. On the right-hand side here, we break out the responses by population subgroup. As you can see, African Americans is extremely high, 85% saying that it was very difficult. And then as we move down and so forth, we can see this. So again, this population, again, is having trouble despite the, affordability and options out there, whether the hospital is informing them and helping them pay or not. Again, there's just a lot of room for improvement here on what we measured. And again, these questions were asked to respondents who had trouble or had been late paying a hospital bill. Have you ever had trouble or been late paying a bill that was sent to a collection agency? 72% said yes. Have you been sued by a hospital to collect an outstanding debt? 23% of this population said yes, 77% no. While paying off your hospital bill, did you have trouble paying other monthly expenses? 84% said yes. Again, these are, benchmark measurements, folks, that we're just trying to, hang our hat on here and really understand and quantify where the fault lines are. And then how easy was it to understand your hospital bill? And again, this was asked to respondents that had trouble or were late paying a bill. Only 7% said it was very easy, 29% somewhat easy. So about a third considered it easy. However, 63% said it was not too easy or not easy at all. And again, breaking out the percentages that said not at all easy or not too easy, going down the list. So clearly there's room for some improvement there for folks simplifying their hospital bills. And then finally, our final question to respondents was educating and informing them of the 2019 law that was passed, that every 3 years an annual community benefit implementation plan, that the law requires each hospital to hold an annual public meeting in the communities that they serve. At the meeting, hospitals representatives listen and learn from the public. And again, this is what was read to respondents so that they can understand their community's healthcare needs where they serve. And then telling them this information is then used to develop what's called a community benefit implementation plan, where partners and hospitals and local community organizations address their community's healthcare needs. Again, this should happen, regularly. This is a population that just visited their hospital in the last 12 months. They are on the lower end of the income scale. Have you ever heard or participated in your local hospital's annual community meeting to discuss the public's health needs? This was asked to everybody. 93% said no. So clearly there's some room for improvement here of these folks that we spoke to. And again, this is not general public. These are folks that had visited their local hospital in the last 12 months. And we were curious to see, maybe this population would be more aware of what was going on at their local hospital. So with that, I will stop. Hope I didn't go too fast, coming in right in on 19 minutes. So.
Yeah, no problem. Thank you so much, David, for providing us that overview of the data. If I see that we don't have questions in the Q&A at this point, but feel free to add any questions that you might have, or you can raise your hand or indicate that you'd like to ask a question. And I think Tony will be able to bring you off mute so you can speak your question into the room. But in the meantime, while people are sort of thinking of their questions, I just wanted to ask quickly, David, if you could share some learnings, I guess, around potentially sort of best practices for reaching out and learning from this population in our communities.
Sure. I think one thing more than anything, Allison, is a survey like this has never really been attempted. And now that we have this benchmark data to improve on. And in our projects that we do very often in Colorado, measuring opinions based around income and healthcare needs in the work that we've done, especially in the last couple of years, what we really believe some of the major takeaways are here is that all hospitals and their partners probably could double down or improve on their efforts. Honestly, I expected these numbers to be somewhat better considering who we screened for. But more than anything, we're not trying to point fingers to give anybody a black eye here. We're just trying to measure and understand where are we and how does this vulnerable population see, feel, and experience their experience when they go to a hospital to visit their healthcare needs. And more than anything else, it's just something that clearly there's room for improvement here.
Great, thank you. I see a question about whether the slides will be available, and yes, they will. We are going to be posting the slides and a blog of some top line findings on our website, and so they'll be available there. And I see that Stephanie raised her hand and that she's been brought off mute. So go ahead, Stephanie, who's been a great partner helping us understand a lot of these things that the data shows us even before we were able to sort of confirm or get some alignment with this data. So Stephanie, go ahead.
Great, thank you. I really appreciate hearing the results of the survey. I'm really interested in what you found, and thank you so much for making this happen. My question is around when will we, you referred to it as baseline data. We're going to be working hard on implementation of 1198 in the next 6 months and see it implemented next year. And so are there plans to do this survey again? And if so, when?
I can jump in on that, David. I think, and if you have anything to add, feel free. We don't have specific plans to do a second survey, but I think we've learned a lot from this process and would be really interested in doing that going forward. No specific, so again, no specific plans, but I think we would be interested in partnering again to see where the legislative changes might get us and what the data might show about that.
Great, great, thank you.
Mhm. David, do you have anything to add on that point?
No, you know, Stephanie, give everybody time to implement the laws that are on the books, you know, but this is, you know, I would really love to go into the field again with this, with our same methods, so that and measure this population to see if there is an improvement and how it's going, without question. But obviously, you know, give the hospitals and their partners in the system time, obviously, to implement to see if our next time we went in the field that there was some measurable improvements and the needs of this population are being addressed. So,
yeah, thank you.
Yep.
So I see a question, a hand raised from Don Burns, and also see a question in the chat. So I'm going to address the question in the chat, and then I'll come to you, Don, right after that. The question in the chat is, what do you think is the reason for hospitals not offering support to apply for Medicaid or financial assistance? And how can this be changed? Given that most respondents had lower incomes, most would have qualified for financial support. Instead, they are stuck with lots of medical debt. Do you like me to jump in on that one too, David?
Yeah, Allison, I think since you are the policy maven, and I would defer to you perhaps on those reasons why.
Okay, great. Yeah, thank you, Daniel, for the question. It's a really great one. I think, you know, probably some of it at the hospital level has to do with administrative burden. However, there's a lot of benefit there possible for both the patient and the hospital if they are connecting people to either a Medicaid program which reimburses at higher rates, or to a financial assistance program which can sort of give people more time to pay off more of their bill. And we think the answer to this is you know, policy, new laws and protections, and we sought to accomplish some of that through through House Bill 1198, which passed last session. And the main way that this that the bill will accomplish, you know, what you're talking about in your question is by requiring screening by hospitals. You know, they're going to be required to screen people for eligibility for public programs like Medicaid and Medicare, emergency Medicaid, and CHP Plus, the health insurance program for children and pregnant women, and also for financial assistance for people who may not be eligible for those programs. And you know, it also creates liability for hospitals if they don't do those screening requirements. So really trying to make sure that there's enforcement in place. So we'll be watching the law while we're working with the department to implement and make sure that, you know, there are strong provisions in place for that screening and the steps hospitals take to connect people to what they're eligible for. But it's definitely something to look out for and watch as things get implemented.
Mm-hmm. Sure.
And then I'll go ahead and turn it over to Don Burns. Welcome to the call.
Thank you, Allison. Thank you very much, David, for your presentation of the data. And I apologize for being late arriving. So I'm looking forward to seeing some of the early slides. The latter slides indicate problems very much like appeared across the state in what is known as the gap map, which has to do with enrollees versus eligibility for a number of benefit programs. And my sense is that particularly in rural areas,
Mm-hmm.
Local communities and organizations simply don't have the capacity to enroll people and make sure that they're making best use of benefits. Would you agree with that in terms of your survey? And what recommendations would you have for assisting local communities to expand capacity?
just to chime in, Don, yes, I would agree in those rural areas are the ones that definitely we showed higher levels of compared to, city versus urban in the sample that they are more challenged. To recommend though, Don, how to help these communities, with the resources without, people are busy, they have limited budgets. I mean, everybody's doing the best they can perhaps to enroll and identify this population. Honestly, I think not knowing exactly perhaps what rural organizations and hospitals are trying to do to educate and inform and identify populations that fall perhaps into our sample I'm not completely familiar with that. And I'm probably not qualified to come up with, the best communication techniques to raise awareness and encourage folks to, embrace and engage and enroll them so that they are covered from where they know what they do. So I don't have a great answer for you there, unfortunately. But again, I would think that of the resources that are available for local governments and organizations in rural communities, which we do a lot of work around and do a lot of our research on, because we're doing ballot measure surveys all the time in very, very, rural areas, unincorporated areas, and so forth. And this is just an offhand comment. We find MMS texting that we did actually to conduct this survey, where I can get a good coverage of somebody's cell phone population, and I can at least send them a message inviting them to become more educated and informed about their healthcare choices or support or needs, if you will. So, but I don't know if that's appropriate, for this audience. And I do not pretend to be an expert in that area. And with that, I'll ask Allison what she may think, because I'm assuming she has a much better handle on current practices of rural hospitals and what they are attempting to do to reach out to those underserved populations. So.
Yeah, thank you for that question, Don. And I would agree, like it is important to consider the sort of resource constraints in our rural institutions and sort of how we can address some lack of resource or resource shortages there. But we did talk with our rural hospital partners during the legislative process, and spoke about some issues around administrative burden. And I think what both we really recognize and our rural hospital partners recognize is that Medicaid and these public coverage programs are such important payers for their facilities. So there is real benefit in doing the work to connect sort of higher eligible but not enrolled population that we see in rural communities to coverage. And so yes, I think that there's work, there's investments that need to be made in our hospital partners to improve, or some of our hospital partners to improve their capacity to do screening. But at the same time, I think like the fact of connecting people to coverage will bring in some more resource and make sure that our hospitals are able to get reimbursed through those programs that people are eligible for. So yeah, thank you for that question. That's Don Burns, who funded our establishment of the Burns Research Institute at CCLP. So a great partner. Thank you for the question.
Did that answer your question, Don? I hope that's the best we could.
I'll take silence as affirmation.
No, I was muted and Tony has now unmuted me. Yes, at one level it does, but I mean, it seems to me that there is a real role for organizations like CCLP to provide technical assistance to communities. And I mean, it's not just hospitals, it's clinics and so on and so forth. And it's both the know-how to reach out to people, and it's making sure that the staff capacity is adequate and so on and so forth. And it seems to me that there's a huge role for organizations like CCLP to engage particularly rural partners in improving this overall situation.
Yeah, thank you for that comment. I'm not seeing additional questions in the Q&A. Is there anybody else who wants to raise their hand and ask a question, or welcome to ask another one if you've already done so?
Okay. All right. Well,
I think for people interested in this issue, as we've mentioned a few times, House Bill 1198 is going through the implementation process right now. And CCLP is very much involved in that process and in trying to keep sort of our community partners in the loop and involved in that process. And we, as part of that effort, we did create a training, a community-focused training that covers the core provisions in the law and sort of what's left to be decided at implementation and how people can get involved. So if people are interested in either watching that training, you can reach out and we can send you a recording, or you can reach out to me to ask any questions about that process. This training is also available in Spanish if you have Spanish community partners that would like to have more information as well about how to get involved. I'll do a good 30-second pause to see if anyone else wants to come off mute, and then we can go ahead and close. Thank you, Barb, for attending today, for this nice feedback.
thank you. No, thank you, everybody, for your time and interest in this unique research project and what we learned. And please stay engaged, and hopefully we see you again soon, and everything will be posted on the CCLP website. And thank you, Allison.
Yeah, no, thank you so much. Very informative, and we learned a lot from this process, and look forward to next time.
Okay, have a good evening. Bye-bye.